When viewed on a right lateral radiograph, the heart in most dogs and cats sits at a 60-degree angle to the sternum. We will place a clock face over the heart with 12 o'clock at the vertebral column and 6 o'clock at the sternum. The long axis plane of the heart goes from the apex to the base. The short axis plane is perpendicular to the long axis plane. To obtain a short axis view, the transducer index and therefore the ultrasound beam are placed at an 8 o'clock position under the heart. From this starting position, you can fan or slide from the apex to the heart base. All patients are not the same. In some animals, like Dobermans, the heart may be at a 90-degree angle in the thorax. To obtain a short axis view, the transducer index and the ultrasound beam are placed at a 9 o'clock position under the heart. From this starting position, you can fan or slide from the apex to the heart base. Note that your movements are from the sternum toward the vertebrae in this case. In some dogs and cats, the heart is at a 45-degree angle in the thorax. To obtain a short axis view, the transducer index and the ultrasound beam are placed at a 7 o'clock position under the heart. From this starting point, you can fan or slide from the apex to the heart base. Note that your movements are from caudal towards the cranial in this case. In dogs and cats, the heart is not oriented in the sagittal or transverse plane of the patient's body. The heart is not even oriented to the same angle or position in every patient. Because this makes it difficult to give movement descriptors related to the patient's body planes, I use a clock face analogy to describe your beginning position. It is best to locate the right side short axis view of the left ventricle as the starting point for each patient exam, and then view the heart in a short axis or long axis plane for that patient. Radiographs may help you determine the proper starting angle for a good right side short axis view of the heart. If radiographs are not available, you must determine the proper starting angle by evaluating the cardiac image you see on your ultrasound screen. At the proper angle, the left ventricle has an evenly shaped keyhole or mushroom appearance. At an improper angle, the left ventricle appears distorted or uneven. If the left ventricle does not appear equal or even in appearance, try to rotate slightly clockwise or counterclockwise until you see an even appearance. Then from that position, fan or slide from the apex or bottom of the left ventricle to the heart base or top of the heart near the atrium. The index indicator on the transducer shows direction of the ultrasound beam. There is usually a corresponding index indicator on the ultrasound screen. In the abdominal setting, the direction the transducer index is pointing will be on the left side of the ultrasound screen. When you select cardiac settings for your ultrasound exam, the index is automatically reversed on the ultrasound screen. The ultrasound screen will show the index indicator on the right side of the screen. For example, in the right side short axis view, the transducer index is pointing toward the patient's head. The right side of the ultrasound screen is cranial, and the left side of the screen is caudal. A structure, the pulmonary valve in this case, is on the right side of the screen and is cranial to your transducer position. To move the pulmonary valve to the center of the screen, slide or angle a tiny distance cranially. If a structure like the aorta is now to the left side of the screen, slide or angle slightly caudally to center that structure on the screen. In a patient with a heart axis of 45 degrees, the right side of the screen is nearly ventral, and the left side is nearly dorsal. Because orientation will depend on the patient's heart axis, it is easier to refer to the heart as a short axis and long axis view. As in the abdominal setting, the top of the ultrasound screen, or near field, is where the transducer touches the patient's body. In this case, the transducer is touching the right thorax, so the top of the screen is the patient's right side, and the bottom of the screen, or far field, is the patient's left side. The right side long axis view is achieved by rotating the transducer 90 degrees clockwise from the right side short axis view. The transducer index is now pointing toward the vertebrae, or dorsally. The right side of the ultrasound screen is dorsal, and the left side is ventral. The transducer is still touching the patient's right thorax. The near field of the ultrasound screen is still the patient's right thorax, and the far field of the screen is the left thorax. The apex of the heart is the most distal area near the tip of the left ventricle. The base of the heart is the most proximal area near the atria. To see the atria better, you must slide dorsally toward the heart base. From that position, to see the apex, you must slide ventrally. In the left side apical views, the transducer is placed on the patient's left thorax near the sternum. The near field of the screen is ventral and shows the apex of the heart. The far field is dorsal and shows the heart base. The transducer is pointing toward the patient's left side. The right side of the screen is the patient's left, and the left side of the screen is the patient's right. For orientation on the ultrasound screen, the near field or top of the ultrasound screen is the point on the patient's body where the transducer is touching. The far field is the opposite direction. The right side of the ultrasound screen is the direction the transducer index is pointing, and the left side of the screen is the opposite direction.